Before we get into this interview, I want to give a shout out to Growth Accounting Services, where specialized financial management meets industry specific expertise. They're known as the doctor's accountants because they're deeply committed to understanding and serving the financial needs of healthcare professionals. Their deep understanding of the medical industry enables them to assist with everything from structuring your practice for maximum tax efficiency to setting up your business structure, ensuring wealth protection and estate planning. Their firm offers an extensive suite of services designed to address the unique demands of the medical industry. Their goal? To provide you with peace of mind and clear financial insights that support growth and stability. With gas accounting, you're choosing a partner focused on precision, timelines, and proactive support. Let them help you make informed decisions, minimize tax liabilities, and maximize your earnings, allowing you to dedicate your energy where it matters most. Reach out to Gas Accounting to discover how they can support your journey to financial success. You will find the link to their contact form in the description box below. But without further ado, let's get into the interview with Tafi from Vimbo. Hello and welcome back to my channel. I'm Tasneem Abrahams, the founder of the Private Practice Growth Club, and on this channel we share tips, tools and tutorials for health professionals starting and growing private practices in South Africa. Today I have the lovely guest Tafi from Vimbo, and he's going to share with us all about the incredible innovations they have in the digital space of health, and particularly mental health. I'm really excited to have you here, Tafi. Welcome.
Hello, thanks so much, Tasneem. It's a pleasure to be here.
So I'm going to let you introduce yourself. Tell us a little bit about yourself and the company that you work for.
Yeah, thank you. So I represent Vimbo Health as a co-founder and the CEO. We are in the digital mental health space, which is of course broad, but I'll break that down for you. My personal journey is not one of a practitioner. It's one of a patient. I was living in the UK, working in the finance industry, and I was just very lucky to reach out for help. And being as well-resourced as they are, I was offered face-to-face therapy, I was offered group therapy, or I was offered to try a self-guided digital therapy that they were using there and having good results with. So just due to where I was at that time, in terms of stigma, standing, and also my diary and commitments, I chose the self-guided digital option, thinking it was a get out of jail free card, but I was impressed just how effective it was. And I was able to myself recover from severe anxiety and depression just by following this self-guided tool. And so that obviously planted the seed of me understanding that mental health is something that can be solved and started to be looked at early, and also the idea that help is out there. But the one thing that I was conscious of, as grateful as I was for that platform I was provided and the help I was given, the one thing I was conscious of is that I felt like an accidental user. Being born and raised in Africa, a lot of the metaphors didn't sort of resonate with me, then, or I understood their meaning basically to have a therapy, but it planted the seed in I was thinking about the African context, and I just felt an obligation to be the one to start that journey. Luckily, my co-founder Sherry is a practitioner. She was working within the UK NHS, specifically in that division, learning about how cognitive behavioral therapy is adapted to digital, as well as providing those interventions. So she shared that. Being from Durban, and we came together essentially to be the ones to think about, well, what is the African context in terms of language, in terms of tone, in terms of metaphors, but also the technology, because, in San Francisco, they're not thinking about load shedding and what happened with, initially when I lived in the UK and I'm on the train, the person next to me is watching Game of Thrones in full HD with no concept of things that finished.
Yeah.
Definitely, it takes thinking about our users in a holistic sense when we're building these interventions, and it's so important, So that's the journey we undertook.
So I'm glad you mentioned it's really an incredible journey that your own experience actually led you to think, well, how can this serve others from where I'm from? But I'm glad you brought up this idea that, Africa, we don't have the same access to technology and internet and things like that as in so-called first world countries. And so what would you say were the first kind of objections to your idea, typical objections to your idea when you said that your target audience was specifically people from Africa? And the reason I ask that is because right at the beginning of COVID, when everybody was scrambling around to suddenly provide telehealth, there is this OT practice that was the first completely online practice called My Online Therapist. And I remember they also, were very innovative in their thinking that they were going to become, and their target audience were people in remote areas, people who have lack of access because of being in impoverished areas. And their first objection was also, but if you're targeting impoverished areas in Africa, what about internet? What about, electricity? So did you have that same objections initially when you had this idea and wanted to launch this platform?
Yeah, no, that's a great question that you raised there. And COVID changed the game in terms of just acceptance and trust of technology. If we look at online shopping in South Africa, like before COVID, people were literally afraid to enter their card details into something or anything, and it created that barrier or reduced that fear through doing and through interacting. And it's also true for digital health in terms of it did create this desire to understand digital health. But I don't think until now, people in South Africa were aware just how far behind we've been in the area of digital. I think COVID brought that to light in terms of, as you say, teletherapy being sort of new, but something that, in other countries, they were just ramping up what already exists, whereas for us, it's because we were already behind. So that being behind is still there. There's still some catching up to do. So it's twofold. It's, as you say, the user aspects and the user challenges. How are those addressed? So fortunately, because we are thinking of the African user, those are the boxes that we immediately aim to tick anyway. So we have high acceptability in terms of language, tone, data cost. These are things that we're really conscious about, and we've baked in. So that is actually our advantage and why, why all OTs should recommend us. But then, in addition to that, there is something to be said for how ready is the healthcare system to adopt digital, because at the end of the day, technology can exist in isolation of a healthcare system, and sometimes that's how it's seen. But in the best case, it's integrated into the healthcare system. We're not in competition with the healthcare system. It's about how do we uplift the patient? How do we uplift the system? How do we bring efficiency to the system? How do we solve issues of capacity that are in the system? How do we solve issues of quality of care, more importantly, for the healthcare system? So that integration, and that's the approach that we've taken, where we are therapeutic, and we want to integrate into those referral pathways in order to boost your practice, to help your practice, help more people better, get a better relationship. So at the end of the day, that adoption is less about the user, interestingly. It's more about the biases and sometimes even the stigmas of the decision maker to say what is their relationship, their personal relationship with mental health, sometimes their personal relationship with technology that leads to biases that result in an incorrect decision about whether or not to integrate digital pathways into the practice. So there's a lot of, we have to, and it's not out of a lack of desire, it's out of sometimes a lack of ways of thinking about digital health, because I'm in digital health every day. So I can think about, okay, these are the boxes that one might want to think about, but if you interact with it once a month, once every 2 months, something great comes up, you can sense it's great, but you're not sure if you can safely onboard it. What standards should it even meet in the first place? So that's the barrier a lot of times to patients actually having access then and being given the idea, because, the relationship of practitioners and patients is very special. And there's an opportunity, given that if the practitioner, the provider, the payer, public, private sector, is themselves over the line being comfortable.
So the first thing that pops into my mind as you're speaking is, you are in the technology space, so you would be aware of that adoption curve, right? The early adopters, and then you get peak, and then you get the rest of the people trailing along. And, it's common knowledge that when the people who lag behind when it comes to adopting technology, predominantly the reason is around fear. And just listening to you speak about, it's normally not the end user that needs to adopt. It's first the person who needs to refer and recommend these things. 100% I agree on your assessment that a lot of times practitioners, it's their bias towards technology. And my experience with health professionals, particularly in the allied space, is that they have a lot of fear around technology. One, because they feel that they see it as competition. So it's, AI is trying to take over our jobs. The robots are going to become the therapists, and then we won't be able to, have a practice anymore. And two, because they themselves are not technology savvy. So their fear of me not having a good handle on technology, now I'm like recommending a form of technology. And I'm supposed to be the professional and the more like knowledgeable. Is that what your experience has been? And then how have you addressed those fears to help practitioners become more innovative with the times to embrace digital therapeutics?
Yeah, so it's interesting because of course we are a startup, so our resources are quite limited. My time is quite limited, and individually, and almost all of marketing. So the amount of time and educating for the sake of just raising the awareness of the safety and digital essential does take away from our ability to do other things and to continue on viably. But we have nonetheless, as people who've taken an interest in helping practitioners, because want to help patients. It's actually our passion to help practitioners too. We have taken it upon ourselves to provide a lot of training. So we regularly do trainings, some of it actually specifically to OTs, where we invite an OT who's already using Vimbo with their clients to kind of break that stigma and to show that it can be beneficial. What she was talking about, it reduced my time to report to insurance payer, because now I was able to show the insurance payer that these were the outcomes and the graphs that came out of my Vimbo dashboard. These are the outcomes and the graphs that came out of my Vimbo dashboard, and I'm able to correlate that with what the patient is saying. And then therefore that lifts the practice, because from a payer perspective, that practice has got its stuff together. It's showing them, it's telling them anecdotally what the patient says, but it's also providing other information that. So essentially a lot of training and a lot of really showing those case studies because we do now have quite a lot of OTs that are using us, fortunately. So we're able to have them as our ambassadors, if you like. So that's been very helpful, and is a big way that we address it through training and education.
And then what about, the aspect of seeing technology being a competitor, where, as it sounds like you are talking about it more being a tool in your practice toolkit. So how do you respond to those kinds of objections?
Yeah, and it's again, it's only through awareness, because there can be a preconception that technology wants to take over, and maybe that is also how some technology positions itself. So I guess I can't speak for solutions that say we are the final. I can't remember the phrase I'm looking for, but we are the silver bullet. Yes, that's it. So we are the silver bullet for all mental health, and that's certainly not what we're proposing to be. We're proposing to be something that is integrated in order to provide more of a stepped care journey for an individual. How do we allow the same individual who would have backed out of all care to enter the journey of care and then be part of that practitioner's process, so that we keep them basically, and also the practitioner keeps. So actually these technologies can result in someone who would have shunned all forms of help for actually now being available and being open to a psychologist. So because I've interacted with digital health, I myself as an individual, I'm actually open to have face-to-face therapy when I feel like the need is at that more acute level. So I think there's a lot of just making people aware that technology can be integrated, particularly approach is to integrate. The second thing is just that awareness that there can be additional relationship in between sessions, because you get people who are in areas, they come once a month, once every 2 weeks. In that time in between, they're not really able to practice all of those tools in an efficient way, and you're not able to keep that bond with them. So we're able to keep the therapeutic bond going between the practitioner and the patient, with homework exercises, with continued work. And then when they come in, you get more value out of the session. The person also feels more supported. The practitioner said, I was given Vimbo by Tasneem. That's how they see it. They see it as Tasneem is so good, and she's so dedicated to looking after me, that she's also, in addition, giving this tool, essentially. So we do find that it does not at all distract from what the therapist is doing. If anything, this patient sees themselves as getting the first class ticket in terms of their help. They just see that I'm getting a better step, and that's the feedback.
Yeah. So talking about other technologies, And this is maybe where you can share a little bit more specifically about the app and maybe give us some insights into what the back end is. But what makes Vimbo then different? Because we are also in a technological age where you get all kinds of apps for brain training, for mindfulness, for, then on the App Store, you can just type in CBT and I'm sure you'll get like a number of apps. What makes Vimbo, aside from the African component, what makes Vimbo different as a digital therapeutic tool?
Yeah, no, I think perhaps I'll share my screen and just allow you to understand how we contextualize that question. So in the area of mental health, there is generally I need to understand the landscape. So in the far left, there are your general wellness tools. So your meditation apps, even just a website blog, some general information. That is amazing. We need more of that. And that's all really great. So what happens is that between that level of just preventative wellness, when a person needs more help, there's often then the only option is standalone high intensity intervention, which is, for example, your medication, inpatient care, your in-person therapy, or television. So these things are all amazing. But of course, we will find that sometimes when a person doesn't have the confidence yet to interact with those, it's kind of like they've gone straight to the main course before they've had a starter to just understand the restaurant, the vibe, and everything. So when a person doesn't have that confidence, there can be that avoidance because of stigma, which means that a very good candidate for face-to-face therapy actually turns away, unfortunately. And then there's also the issue that if I have the confidence, also I can afford the full levels of help, and that's amazing. But for some people, the affordability becomes an issue. So this also speaks in the context of in the dosing where, let's say, for example, the EAP has given me 3 sessions with a person. I know that what I can get out of 3 sessions is going to be limited. Their digital tools help is that they allow for us to bolster what can be done in those 3 sessions so that we're getting better outcomes at a more affordable rate for the individual. So that's sometimes how we also think about affordability. And that ties into also just quality of care. And then, of course, we know a lot of people who know from help. So when we are active in our role, we are trying to bridge the gap. As a low intensity intervention, we can be used in standalone as a way to guide people into the journey of wellness. They can start to get language around mental health so that when the psychologist is available, let's say the waiting list, they have the language, they're able to articulate themselves, the history of their difficulties can be shared in a peer compliant manner. And so when starting from scratch and that person has had help, so it's a step along the way of the person's journey. And of course, it can also sometimes function as a standalone. So perhaps you have an OT where the budget for return to work is insufficient anyway for a psychologist. So it's better to give them something, in which case can be given as a form of help for those individuals. So there are ways to get benefits in both scenarios. And that's where we fit into the journey.
That's amazing. And I think, then at the very beginning of this discussion, we spoke about how, common objections to using technology in an African context is, but, internet, load shedding, all of those things. But actually balancing that out with the affordability, the fact that one-to-one intervention is not affordable for everyone. The cost of being able to access technology is far less than it is to access one-on-one care. And absolutely, like you said, if you have a patient who either because of distance, because of living in remote areas, or they don't have lack of transport, or because they can't afford weekly sessions, having that as an in-between buffer so that they don't lose. Because, that's the thing with mental health care. Even in physical care, but generally speaking in rehabilitation, if you don't have that regular, consistent input, then every time you go to the person, you go away, you lose a little bit, and you have to almost start back from scratch. So being able to kind of keep that consistency going means better outcomes for you, so you have a better retention of your client rate. So maybe talk a little bit about that on how you've now addressed like how Vimbo is different from a client outcomes point of view, but from a practice, like in the private sector, how can using Vimbo actually also benefit you as a practice owner in terms of your practice objectives?
Amazing. No, that's a great question. And once again, I'm just going to share here. So what is the app doing? On the patient side, it's providing them with skills that could be helpful for them. They are CBT based. over 7 to 12 weeks and trying to build skills based on what we've seen coming through from the users. So this is quite typical on the far left of a skill building session where the client is able to go through learning of a skill in text or audio, and then we're able to then recommend a practice for that specific tool so that we're getting that practice focus coming in. So the example you're seeing here is worry management, how to set times to worry and get used to the idea that a worry doesn't have to be something you do through the day, restricted to certain times. That's a behavioral technique. So we're teaching them that component and then giving them a way to log a reminder and a goal around the practice. So that practice component is what's also then key for bolstering an adjunct use case, because your psychologist, for example, could want you to, each time you're in a situation that triggers you, to start to analyze that situation. So the example you're seeing there is a tool for looking at, okay, what's happened, what are the thoughts I'm having, emotions I'm having, the behaviors, and start to understand how those things are connected and be able to do that therapeutic practice in real time, essentially. Now, we are also able to provide this in local, which is part of localization. So this is how we're able to provide more to the client when they leave our door, because they can continue a structured therapeutic process. Now, the key for the practice is that your client is not doing that all alone. So quite clearly, we want to improve the outcomes, but we're also thinking about how do we improve the payer reporting on the basis of given this person the app, great, but then what happened after the person got the app? So we assist in terms of that reporting of outcomes where the OT, the practitioner, is not the final payer in those scenarios. And then, of course, we are also uniquely focused on practice management to say, how do we help the practice to manage cases, to share these cases in mental health context, doing, and to do all of that in a peer compliant manner. So for practices, what we provide is our practice dashboard, which is here, where practitioner is also able to follow that user's journey as a supporter. So this is a real but anonymized user where we can see they were super active for that period of 6 months. We're able to see what they did in terms of meditations, what skills they have tried to build. We're able to see their symptom progression over time in terms of those scores. So it really does start to ally the practitioner together with the patient in this journey and create also information and data that can now be captured in between sessions, so that when the person is saying, I was feeling like this, you'll be saying, well, actually, I've seen that already. And it's now a conversation which is more high quality and with the right language. It's actually some who are not the right language, but more language really around the sensitive feedback. So that's just an idea of how we are able to, I think, really uplift the patient, but also focus on uplifting practice and
yeah, I'm just from my own experience as a mental health practitioner, like I have a client who isn't on the app yet, but we had a period where I was going to be away and she was going to be away, so we had to stop like 2 weeks. And so I do have built into my practice management like a form, like a therapy coaching check-in form, where it asks similar questions to what you would ask in the app, because the reason I needed that was so that she has a place where she can, pour her thoughts onto before it gets lost, like you forget when you see the therapist again. And so that it also saves time, because now the client is paying for that hour session. You don't want to waste like a quarter of that session on like recapping everything you missed in the last 2 weeks. So for me, I could then, before our session, go and check in on a check-in form, see what her ratings were and what her things, her wins and her struggles were, so that when we get started, we just refer straight back to that. And it often prompts her to remember, what was she struggling last time? So that's an isolated example of basically how the Vimbo app does that on steroids. Plus, it allows you also to see the trend, because now, of course, I can't now see the trend, because every time she fills in that form, it doesn't combine the data to show me, like, what is the ups and downs. I can only look at the form as an individual, isolated, like, record form, So that's really what I like about that, is that it gives you that kind of identifying patterns. And I mean, in mental health, that's what we ask our clients to do all the time, is to like, what was the pattern? Like, did you notice anything like when you slept this time or slept that time? And it's almost like this app is giving you that all that data that you can really enhance your therapeutic outcomes with your clients. So which is really wonderful. I just want to also comment also is that I always say this often, like it seems like a stupid thing, but for me, the aesthetics of a tool is really important. So, I mean, I said this with the practice management tool that I also spoke to. That strikes me about the app. I've tried the demo, is that it's really nice to look at. So it's like, you feel like you want to open it. It doesn't feel like this dread and gloom. Like actually, the colors are quite pretty. Even the font that is used is quite friendly. Was that like a conscious design decision, like when you designed for the user experience, that it must look good and feel nice to use as well?
Yeah, no, absolutely. Because Africa is beautiful. So when we say made for Africa, naturally it should be colorful, right? Because this is a sunny, colorful place. It should also just look aesthetically pleasing, but also have that tone of movement, which is what we associate with Africa. So we did go through quite an extensive process of identifying what feel we wanted. Because at the end of the day, that look and feel is actually part of the therapeutic intervention. It's part of the formula. So it was quite important that we spend a lot of time on that. And thank you that you gave that feedback. And I think, yeah, we were keen to say if it's made for Africa, yes, we're not trying to say it's exclusive for a certain type of person, even a low-income person. We want it to be accessible and to feel accessible. But we feel part of that is that it should be beautiful and then still be low data, still have a lot of offline capabilities and really serve all of those communities. So thanks for your feedback. And yes, that was our hope.
So, okay, then tell me now, for those who are listening to this and they're like getting excited, like, this is something that I'd really like to check out. Maybe talk to us through the adoption journey from, as a therapist who is in the mental health space and I want to use this app now. What is the journey of the end user then, from the therapist all the way to the person using the app?
Yeah, no, thanks so much. So as I mentioned, we do have a practice account, which is free to set up, by the way. There's no charge for just having that practice account. Charges only occur when a access is created for an individual. So you can sign up for a practice account by following that link there, www.vimbohealth.com/sign up. It's a 1-minute form which creates your account. Within probably half an hour, you have a link, your account is live, and you can click in there. So from there, you can start to create that access for your clients. What we do is that we build the practice at the end of the week for the practices that have been created by the practice. But we do have a process whereby a practice saying, or a OT saying, this particular person or all the people are going to be paying out of pockets. In that case, when the access is created for the individual, the OT also simultaneously provides that individual with their payment link, which we provide as part of training to say, for those out of pocket, that's how payment is taken. In those cases, it's taken just to help people, but then we do take our fee from predominantly practices who are creating the access. And our pricing then to do that is essentially 1 to 90. Doing that per client that's actually onboarded with access. So you could set up a practice account and nothing happens, nothing is built. But when you do have that client, that it becomes a good fit, raise the access for them, that's when the purchase would be built at 90, which is covering 6 months of access to the app, access to the web dashboard, and training and support. And once again, in the case that the client is going to pay direct, then that can also very easily be done time of creating the access.
So let's say I go and sign up with a practitioner dashboard, and then I go into the dashboard. Do I then just add my clients directly into the dashboard and then grant them access? Because this is an app, right? So you can get it on the Apple Store or on the Google Play Store. And then so what happens there now? I've added my client. What do I then do?
So you've added your client. And when you've done so, you have had the opportunity to request consent from them. Going to just make this bigger. To just take a full screen. So when you have signed up for your dashboard, you're able to request a new user access like this. You can enter client's details. If there's any relevant information, perhaps maybe they're from a specific company and you want to track that in your practice, maybe there's an insurance number that you need to track, you enter that. Then you enter your role, which can be case manager, can be OT. And then you would choose whether you want to follow the person's journey. Because remember, you don't always have to have a person whose journey is linked to a support. If it is, you can keep that checked. If it's not, you can keep it. And critically then, if you have other colleagues or practitioners who you want to already add to the person's journey, you can do that in the next step, which is request consent from other supporters, which is, for example, there's a psychiatrist already, or they have a psychologist, and they say, I'd also like a psychologist at no charge. You can add that person also, and they will receive a notification. If they don't have an account with us, their account will be set up and so forth. So we manage that whole compliant process. So that's how you add, for example, colleagues. So this is speaking towards what I said about practice management. How do we easily share cases in a peer compliant? How do we bring in outside practitioners in a peer compliant manner? And that's where I was talking about that integration. We're not replacing, we're actually uplifting. So when we create this code for the individual, it is now linked to you as a practitioner together with the setting that you've made. And when the person starts the journey, they will be requested to grant consent specifically for the cases and for the people that are tied to that. So you will at this point receive those details to say, this is the person's code. It's also sent to you by email, and you're able to share that on with your client. Maybe they're sitting next to you. If they're remote, you can send them an email. If they are paying directly, you'll also then send them a payment link, which we provide. So once you essentially sign up, you are also signing up to receive that additional information in terms of payment links, in terms of very simple information, but it is then provided to you. And by the way, you're also able to get demo access to the app as a practitioner, because of course we want you to have an awareness of what you're recommending.
And then, so the client then they then download the app onto whatever device they're using. And so this is also another thing that I wanted you to just touch on, because also then what's different then with Vimbo is that, yes, anybody can download the app, but you wouldn't be able to just purchase it on your own. So do you have to get access through a registered provider?
At the moment, yes. At the moment, that is our model, but it also does improve the therapeutic relationship, because your client is knowing that, how thoughtful, I wouldn't have had access to this if you hadn't taken the initiative to yourself become aware, to make me aware of it, and to grant me access in this way, even if they are paid directly. So we do work through the practice, through the referral pathways. And what we're doing is we're strengthening that already existing bond.
Okay. And so they basically get this code that gives them access, and then they have the app on their phone, and then they can start using it.
Yeah. It only takes a minute or two for the client to get set up. That's a very fast onboarding process, because we believe in shortening the time between interest and action. Obviously, that waiting list is often a matter of weeks. So we're turning that into 5 minutes. From a person having that moment of curiosity to them getting started with the treatment intervention, a way of how we're trying to do.
So once the client has access to this app, how do you ensure retention, that they use the app or actually get benefit out of it?
Yeah, I mean, there's no perfect intervention in this area of mental health, whether it's face-to-face therapy, whether it's a digital tool. So we accept that for some people, it might not have been the right intervention at the right time. It could have been the right intervention at the wrong time. So there's a number of scenarios. So we know that. What we do try to do is to monitor that closely. In our research study of our own, we were able to have 71% retention, people staying for 2 weeks plus, which we feel is good. And then from those who stayed for 2 weeks plus, we're able to see 53% of the ones who were in moderate levels of difficulty for depression or anxiety meet that recovery and have that outcome. We believe a design that speaks to the individual, a language that speaks to the individual and captures the individual, and also just making it interesting, making it as bite-sized as we can. There's no one who's ever going to have, I guess, 100% of. We try to. We believe our outcomes are beneficial enough for broad use.
Yeah, I mean, it's the same as in my line of work with people with ADHD. Often homework doesn't work for them, because unless you have, so for some clients, I actually have to have set times where I have to send them WhatsApp reminders and things, And obviously, the benefit of an app is that it has inbuilt notifications. I mean, I've obviously tried the demo out, and then now and again, a message will pop up to say something like about mindfulness or drinking water or exercise or something like that. And that is something that I suppose that would be another benefit as a practice owner, is that you don't have to have so much mental load on your plate to, like, if you've got multiple clients, to like remember these little kind of interactions that you would have to otherwise have like reminded yourself to check in with this client, to check in with that client in between. So what I wanted to know though is it's a 6-month access. What happens generally when people reach the end of the 6 months?
So people can continue. There is that option. They could pay out of pockets to do so. We'll guide you through that. Or they can just stop having access. So it's really up to the individual. You can position it with them to say, look, if you'd like to continue, this is how you do it. And then it's up to the individual. Because part of the offer and part of the reason why 6 months is great is because, of course, we're not saying to someone you are forever going to be in difficulty. We're also presenting it as time limited, which Amy, that's the difference between us and, I guess, your general mental health, is that our scenario, the scenario that make us the most happier when people say, I'm using the app less because I'm actually functioning and doing the skills in my real life. So that is the goal. What is to get functioning in their real life. So while someone can continue, is that idea of a time limited process also helps with it.
Yes.
And whilst they can continue for maintenance, if they still want to meditate, they still want to problem solve, I still use these tools regularly myself, they can do so.
That's amazing. Thank you so much for sharing all the information. I think I'll obviously put all the links in the description box so that people can find out more. And I know, obviously, you, like you mentioned, you do a lot of training. So let's say there are practitioners out there that want to join one of your webinars to get a more in-depth, idea of the app or ask questions, things like that. What is the best way to access some of those trainings?
So really the best way is, of course, to sign up for a practitioner account if you're already so inclined. But another way is to just really join our newsletter, and then you stay in the loop. When we're doing a particular training, you'll be able to just be aware that it's happening. So I will share screen just to show that.
Now, obviously, you also said that, you are a startup. So as a tech startup, this is the initial product. Maybe you can share with us, do you have any plans? Are there any plans to add to the current features? Like, what is the vision for the app going forward?
Yeah, no, absolutely. So just circling back on that prior point, so OTs can either sign up by going to vimbohealth.com/sign up, or you can just join our newsletter, get repeated information, vimbohealth.com/newsletter. And then that way you can stay in touch. So we are, funny enough, just on the knowledge, basically, from our research activities, from being live in the market, from understanding what people locally need and want. So we've just released that in terms of having, for the first time, local language, in terms of having new tools, new features. So we've just now come out with that. So our focus is on making people aware of all these great new tools that we added. But yeah, of course, we are going to keep making incremental improvements. Down the line, we do see more languages coming on board, as well as a lot of really just exciting tools and features to on board.
That's really exciting. I'm excited. And of course, I have lots of ideas, which I will probably send you all my ideas as well. But I think just as a closing and on the subject of language and local is lekker, maybe just end off with giving us a bit of a insight into where the name came about.
All right. Vimbo is more correctly pronounced Vimbo, which is short for the name Vimbo, which is Shonan, which means faith, hope. So that's where it came from. We are forever called Vimbo.
That's really beautiful. I love that. So thank you so much, Tafi. It was very fascinating. It's really exciting to see such innovation in the space. And I hope that lots of practitioners check it out. Like you said, it's free to create a practitioner's account and then get access to a demo so that you can try it out for yourself and see how easy it is to use as yourself. And then that would maybe allay some of that fears to recommend it to clients. Any last words, messages that you'd like to share before we close?
Yeah, I think, no, it's exciting to see the wave of interest from practitioners really getting on board. I just do think it's this exposure. People just need the information to understand what's out there, why it's safe, and why it's okay to use. I think there is a lot of inspiring practitioners who are out there, including yourself. And I'm just grateful, really, to be able to rub shoulders with all of you. So thank you very much.
Thank you. Thank you so much.